46, female, considering facelift. Should I have Invisalign treatment first? I'm getting Invisalign and was wondering if it's better to complete the treatment prior to a facelift procedure. Your input would be appreciated.
Thank you for your question. You're 46 years old and you're asking if you should complete your course of Invisalign before having a facelift. Well, certainly that's a very good question. I can certainly give you my perspective. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I specialize in cosmetic eyelid surgery, facelifting surgery, and hair loss treatment. I would certainly share with you my experience with people like yourself who, to get the opportunity to use something like Invisalign to help realign their teeth. So, understanding that a facelift is really about restoring the relationship of sagging skin with the underlying structure of the face, you could probably understand that Invisalign, as it pertains to your teeth, is not likely to have that much of an effect. And I'll explain why. If you think about it, a facelift, what are we doing? We're lifting sagging cheeks, we're restoring jawline definition, we're improving the angle of the neck. And so, are we putting that much tension on the mouth? Hopefully not. Really what we're trying to do is reestablish relationships so that the sagging cheek is repositioned, the jawline is defined. But I try to preserve the middle and the central part of the face, particularly around the mouth, so that there is no distortion. Patients will often come and say, because they've seen celebrities and people that they recognize whose corners of their mouths are pulled, they ask, please don't do that to me. And so I explained that that's not in any way the intention of any type of facelifting procedure. So with that being said, the position of the teeth should not really have that much of an impact on the soft tissue work that we're doing with the facelift. So essentially, as far as the Invisalign treatment is concerned, depending on how much you need and how many sessions you have to, or how long you have to wear the appliance, you can certainly do a facelift and still continue doing the Invisalign. It will not have any kind of impact. And even if you were going to have other things done through an intra-oral approach from the inside of the mouth, whether it's a cheek implant or buccal fat pad reduction, these things, the teeth alignment should not be an issue. I think that meeting with qualified, experienced cosmetic surgeons who perform a lot of facelifts will give you some insight onto this. I think as a side note, it's important to also make a distinction. When I perform facelifting surgery, I do it under local anesthesia with light sedation, which basically means I'm not concerned about doing anything that can affect the position of the mouth. Now, for my colleagues who do facelifting under general anesthesia, which I think at this point is still the majority, you might have some concerns, even though alignment of teeth and what happens during general anesthesia are usually not in any way related. When an anesthesiologist puts a tube in your throat and puts you under general anesthesia, they are very mindful of protecting the teeth, and that should not have an effect. I just think that from my approach and the way I do surgery, where the person's face is relaxed and their orientation of their teeth is what it is in natural life, rather than having their mouth open and being under anesthesia, I can certainly see no reason why you can't have a facelift while still using Invisalign. So I hope that was helpful. I wish you the best of luck, and thank you for your question.